Welcome back to Pandemic Pills, Favipiravir for COVID, the podcast exploring the science behind Favipiravir role in combating COVID-19. I am Kanak, and each episode we dive into a technical aspect of this antiviral with leading experts. Today, we are on episode 2, that is tracking Favipiravir journey through the body in COVID-19. We will examine the pharmacokinetics of favipiravir, how it's absorbed, distributed, metabolized, excreted in the context of COVID-19. Joining me is Aseema Mishra, a microbiology researcher. Welcome, Aseema.
Really excited to discuss the pharmacokinetics of favipiravir and its behavior in the body.
Let's jump in. Pharmacokinetics is all about how a drug moves through the body. And can you give us an overview of favipiravir pharmacokinetic profile in the context of COVID-19 research?
Yes, certainly. So, pharmacokinetics, or as we refer to it as PK, uh, involves four processes, that is, absorption, distribution, metabolism, and excretion, which is collectively known as ADME. For favipiravir, these processes determine how the drug interacts with the body in studies involving COVID-19. It's administered orally, absorbed in the gut, and distributed to tissues like the lungs, and metabolized mainly in the liver and excreted primarily through the kidneys. Each step provides insights into how favipiravir functions as an antiviral in research settings.
Well, that sets the stage nicely. Starting with absorption, how does favipiravir enter the bloodstream in these studies? Can you give any instance on this?
Yes, absolutely. So, in research, favipiravir is given as an oral tablet and absorbed primarily in the small intestine. Studies show that it's absorbed relatively quickly, reaching peak plasma concentrations about 2 hours after the administration in healthy volunteers. And in COVID-19 research, factors like fever or GIT issues can introduce variability in the absorption rates. Data indicates a bioavailability of around 97%, meaning most of the drug reaches the bloodstream, but food can delay the absorption, a little bit, which is why some studies administer it without food to standardize the results.
This means food can affect the timing, I guess.
Yes.
Once absorbed, how does favipiravir contribute to tissues where SARS-CoV-2 is active, like the lungs?
Well, distribution is a key focus in pharmacokinetic studies. Favipiravir travels through the bloodstream and reaches various tissues, including the lungs, which are critical in COVID-19, as we know, due to due to the viral replication there. And research shows that favipiravir has a volume of distribution of about 15 to 20 liters, indicating that it spreads effectively into tissues without excessive accumulation. It also appears in respiratory secretions, which is relevant for studying its activity against SARS-CoV-2 in the airways. And in severe COVID-19 cases, studies note that lung inflammation or altered blood flow might affect the distribution, but these are still active areas of investigation.
That's fascinating, especially the lung penetration. So, what happens during metabolism? Like, what is your take on this? How is favipiravir processed in the body?
Well, metabolism occurs primarily in the liver, where favipiravir is converted into its active form, which is a molecule that targets the viral RNA polymerase, as we have covered in the episode 1. And this conversion involves enzymes like aldehyde oxidase, and the liver also produces an inactive metabolite. This conversion involves enzymes like aldehyde oxidase. The liver also produces an inactive metabolite, which is later excreted. In COVID-19 studies, researchers In COVID-19 studies, researchers have observed that liver function, which can be altered by the disease or other factors, may influence the rate of metabolism, and that affecting the amount of active drug that is produced. And this is a key variable in pharmacokinetic research.
So you are saying the liver plays a big role.
Absolutely.
Okay. How is favipiravir cleared from the body, and what do studies say about the excretion process?
Well, excretion happens mainly through the kidneys, as we know, with 80 to 90% of favipiravir and its metabolites eliminated in urine. Studies report a half-life of about 4 to 5 hours, indicating that the drug is cleared relatively quickly. In COVID-19 research, kidney function is a really significant factor as severe cases can involve reduced renal capacity, potentially leading to slower clearance. And this can result in higher levels of the drug or its metabolites, such as uric acid, which researchers monitor very closely in pharmacokinetic studies to understand the drug's behavior.
How do these pharmacokinetic properties shape the way favipiravir is studied for COVID-19?
Well, the pharmacokinetic profile informs research design significantly, and studies often use a high initial dose, which is typically 1600 to 1800 mg twice on day one, followed by a lower maintenance dose like 600 to 800 mg twice daily to maintain effective drug levels given the shorter half life of the drug. And these regimens aim to achieve sufficient concentrations early in the infection based on the pharmacokinetic data. However, variability in absorption, distribution, or clearance across patients, especially those with severe disease, is a focus of ongoing research to better understand the drug's performance.
Okay. That variability sounds like a big challenge.
Yeah.
What are some key questions that researchers are still exploring about favipiravir pharmacokinetics?
Well, one major question is how pharmacokinetics varies across diverse patient groups. Age, disease severity, and comorbidities all play a role, and we need more data to map these effects. Another area is drug drug interactions, as COVID 19 patients in studies often receive multiple medications, which could alter favipiravir metabolism or excretion. Researchers are also working on pharmacokinetic models to predict how the drug behaves in different scenarios, which could refine the future studies.
Yeah. It's clear there's a lot still to learn.
Yes, absolutely.
What's one key insight about favipiravir pharmacokinetics that you think our listeners should take away?
Well, I'd highlight that favipiravir pharmacokinetics reveal its potential to target SARS-CoV-2 in tissues like the lungs, which with rapid absorption and clearance shaping its study design. The variability in how it moves through the body underscores the need for continued research to fully understand its role in COVID 19.
I think that's a great point to end on. Aseema, thank you for walking us through the pharmacokinetics of favipiravir and its journey in COVID-19 research.
Thank you so much.
Listeners, tune in for episode 3, where we will explore favipiravir origins and its transition from influenza to COVID-19. If you are enjoying Pandemic Pill, Favipiravir for COVID, please subscribe and share. I'm Kanak and we will see you next time.